In the heart of southwest Uganda lies Nakivale Refugee Settlement, one of Africa's oldest and largest settlements. It is home to more than 180,000 refugees, most of them of Congolese origin, who fled decades of war and conflict, including the most recent surge that began in 2025. Yet for decades, stigma, misconceptions, and inaccessible services denied many, especially persons with disabilities, access to sexual and reproductive health services. But that reality began to shift. In 2024, with funding from CDCS, the Crisis and Support Center of the French Ministry for Europe and Foreign Affairs, and with support from OPM and UNHCR, Humanity and Inclusion launched the Inspire project in partnership with the Association of Refugees with Disability and Medical Teams International, marking the beginning of real change as the one-year initiative set out to break barriers, dismantle misinformation, and rebuild trust between health providers and communities.
The project brought the key stakeholders in single district, including the DHO, the district health team. They were brought together and given enough knowledge.
Over 90 health workers have been trained in disability inclusion, sign language, GBV response, and inclusive data collection, alongside inclusive communication training to break language barriers between Ugandan service providers and refugees.
It has increased on the knowledge of health workers, but also the managers for this organization. The health workers are now confident in identifying different disabilities and tailor the services to the needs of these people.
We had a training on sign language. We are all thrilled and very surprised how they do the signage. It's really amazing. As professionals, you might think we know what disabilities are, but we were surprised that we actually didn't know the details of disabilities.
For the first time, refugees and persons with disabilities can walk into a clinic and truly feel that these services are for them.
Naje kwigwariro hano baranyakira kimwe n'abandi, ntabwo basuzuguye ngo kubera ubumuga bwanjye, banyitayeho.
The project also empowered village health teams to conduct inclusive door-to-door outreaches.
I'm thankful for Inspire project for training us. We had those knowledge to talk with those people with disability and how to identify them and how to talk with them concerning their issues.
To target young people, Inspire turned to creativity. Through the Inclusive Dance for Change initiative, over 200 adolescents joined sessions that used dance and storytelling to confront real-life challenges, build life skills, and discover their voices.
And all I wanted was to feel like a typical African teenager, typical African teenager, typical African teenager. Yeah. African teenager, African teenager, African teenager.
I thank IDFOC so much for the help that they brought, because they helped many adolescents in these refugee settlements. Before, I had no confidence. Yes, standing in front of people, talking to people, it was so hard to me. But now I can have a voice, I can make up decisions, and people can respect me, and I feel good.
Lakini tangia programu ilianza, batoto tunaona kabisa mabadiliko. Tunaona kabisa kuko changement. Tunashukuru sana na hii programu.
The project engaged communities across Nakivale through awareness sessions on sexual and reproductive health and rights, aiming to foster dialogue, break stereotypes, and challenge harmful social norms. As change took root, the impact became deeply personal, reaching women like Anita, a mother of 7 and a refugee from the DRC whose life during displacement was trapped in a cycle of repeated pregnancies, hardship, and misconceptions. Today, she dreams again, makes informed choices, and provides for her family.
Kuko ntari natandika kurubarira, sinari mbonaga imbaraga zo kugenda munje kubashakira. aho natandikiye kubarira urubyaro mbo impinduka nabonye nizo gushobora kuja guhahira abo mfite.
Hii mnazosikiliza ni Radio Fika FM kutoka mji wetu mkuu wa Nakivale kama kawaida.
Over 20 journalists were trained to champion inclusive development, and their voices now echo through radio talk shows, promoting the uptake of family planning services and reshaping public perceptions of refugees across Nakivale.
Tumeweza kushiriki training hiyo na tumepata mafunzo mengi kuhusu kubadilisha mtazamo wa jamii kuhusu watu wanaoishi na ulemavu.
Through CDCS funding, the Inspire project also strengthened the capacity of civil society organizations through advocacy and coordination training to represent community concerns and influence inclusive responses.
So after the training, as a CSO, we happen to improve our initiatives by putting the ramps on our offices. We have standardized our documents whereby on the attendance list we couldn't include them. It is already there.
Through this, the Inspire project, we were able to get knowledge on how to have structure-based advocacy. So mainly what we learned in our organizations was the practices that we needed to change, the internal rules and policies that we had which were not inclusive.
Community-based organizations were also trained in inclusive economic empowerment to improve livelihoods and promote dignity through accessible work.
In our different programs, we have decided to include people with disability among everything. We shall employ them. We need also them to work. What if he doesn't or she doesn't have legs, but she have capacity in the mind? They have ability you cannot imagine.
Ko cyashoboye kureba uko meze ko ndi ikimuga kigashobora kumpa ubufasha nkabona byo gukora muri business yanjye y'amakara ya mututunyanya mureba simpagarara ngukambakamba gusa ariko bindi byose ndabishoboye gukambakamba nk'abashoboye gukora nka business nkayikora.
Local partners were also strengthened with the skills and tools to lead inclusive action and ensure change is not only created but sustained from within the community.
We are a local partner that has gained really capacities in this project, and this is because of humanity and inclusion, having that spirit of working with local partners.
Thanks to the support from our donors CDCS, humanity and inclusion through the Inspire project has broken silence, restored dignity, and demonstrated that SRH rights are not only an idea but a lived reality. This impact will echo far beyond Nakivale, into the hearts of those who now know they are seen, heard, and respected. This is the story of Inspire, breaking stigma, changing perceptions, building a future of dignity, inclusion, and hope.